A tiny spot on your skin that wasn't there last month. A cough that lingers just a bit longer than it should. Your body whispers warnings every single day, but most people over 60 miss them completely. And by the time they finally notice, it's often too late. I'm going to show you 10 early cancer signs that doctors say are hiding in plain sight right now. Not the obvious ones everyone talks about. The subtle shifts your body makes months before anything shows up on a scan. Susan was 64, lived in Portland, felt perfectly healthy. Then one morning while brushing her teeth, she noticed something strange. A small white patch on the inside of her cheek. It didn't hurt. It wasn't raised. Just a little white spot she'd never seen before. She almost ignored it. But something told her to get it checked. That white patch was oral cancer. Stage 1. Because she caught it early, treatment was simple. She's cancer-free today. Her doctor told her most people wait until it spreads because they think mouth sores need to hurt to be dangerous. They don't. Sign number 1. Changes in your mouth you're ignoring. After 60, your mouth becomes a warning system. White patches, red patches, sores that don't heal within 2 weeks. These aren't just irritations, they're your body's earliest alarm. Oral cancer rates spike after 60, especially in people who've never smoked. Why? Because the cells in your mouth regenerate constantly, and after decades of exposure to food, drinks, and environmental factors, some of those cells start misbehaving. Here's what most people miss. They assume mouth problems need to be painful. But early-stage oral cancer rarely hurts. It just looks slightly different. A texture change on your tongue. A small rough spot on your gum. A white or red patch that persists. The key word is persists. Normal mouth irritations heal within a week. Cancerous changes don't. Check your mouth once a week. Use your phone's flashlight. Look at your tongue, the roof of your mouth, inside your cheeks, your gums. You're looking for anything that wasn't there before and isn't going away. If you spot something and it's still there 2 weeks later, see a dentist immediately. But your mouth isn't the only place your body leaves clues. Sign number 2. Unexplained weight loss that feels like good news. Margaret was 67, living in Ohio. Over 3 months, she lost 15 pounds without trying. No diet changes, no new exercise routine. Her friends congratulated her. Margaret felt great about it too, until her annual checkup. Her doctor's face changed when Margaret mentioned the weight loss. They ran tests immediately. Pancreatic cancer, early stage, thankfully. Her doctor explained that unexplained weight loss is one of the earliest signs of several cancers, but people almost always celebrate it instead of questioning it. Here's the medical reality. After 60, your metabolism slows down. Most people gradually gain weight or maintain their current weight. Losing weight without any lifestyle changes means your body is burning energy fighting something. Cancers, especially pancreatic, stomach, and lung cancers, cause your body to burn calories differently. The cancer cells consume energy. They change your metabolism. They suppress your appetite in ways you barely notice. The dangerous threshold is losing more than 5% of your body weight in 6 months without trying. For a 150-pound person, that's just 7.5 pounds. It doesn't sound like much, but it's significant enough to investigate. Don't celebrate unexplained weight loss. Question it. Now let's talk about something even more commonly dismissed. Sign number 3. Persistent fatigue that sleep doesn't fix. Robert was 71, lived in Seattle. For months he felt tired. Not normal tired. Deep, bone-weary exhaustion that 10 hours of sleep couldn't touch. He blamed age. Everyone told him that's just what happens after 70. But when he finally mentioned it to his doctor during a routine visit, tests revealed leukemia. Early detection meant treatment options that wouldn't have existed if he'd waited another year. Cancer-related fatigue is different from normal tiredness. Normal fatigue improves with rest. Cancer fatigue doesn't. You sleep all night and wake up exhausted. You rest all weekend and Monday feels impossible. This happens because cancer cells alter how your body produces and uses energy. They release chemicals that cause inflammation. They affect your red blood cell count. They change everything at a cellular level. Pay attention to fatigue that persists for more than 2 weeks despite adequate rest, especially if it's accompanied by other symptoms on this list. Your body isn't supposed to feel this tired. Age makes you somewhat less energetic, sure, but it shouldn't make you feel like you're dragging yourself through quicksand every single day. And while we're discussing things people blame on aging, sign number 4. Changes in bathroom habits nobody wants to discuss. Thomas was 69, lived in Arizona. For 3 months, his bowel movements changed. Sometimes constipation, sometimes diarrhea. Nothing consistent, just different from his normal pattern. He figured it was diet-related, tried fiber supplements, drank more water. Nothing changed. Finally, his wife insisted he see a doctor. Colon cancer, stage 2. Caught early enough for successful treatment, but his doctor said most men wait until they see blood before taking it seriously. Here's what happens. Colorectal cancer changes how your intestines function long before it causes bleeding. The tumor affects muscle contractions. It changes how your body absorbs water from waste. It alters transit time. These changes create patterns you've never experienced before. Pencil-thin stools, persistent feeling that you haven't completely emptied your bowels, alternating between constipation and diarrhea with no dietary explanation. The critical factor is persistent change. 1 weird week isn't cancer, but 2 months of bathroom patterns that don't match your lifelong normal? That demands attention. Most people over 60 have established digestive patterns. You know what's normal for your body. When that changes and stays changed, your intestines are trying to tell you something. But cancer doesn't just hide in obvious places. Sign number 5, a cough that won't quit. Linda was 66, never smoked a day in her life, lived in Denver. She developed a cough in January. By March, it was still there, dry, persistent, worse at night. She blamed allergies, then a lingering cold, then the dry climate. Finally, in May, she saw a doctor. Lung cancer. Non-smoker lung cancer, which is rising dramatically in people over 60. Her doctor explained that 20% of lung cancer patients never smoked. Environmental exposure, radon, secondhand smoke from decades ago, all contribute. A cough that lasts more than 3 weeks needs evaluation, especially a dry cough that doesn't produce mucus, especially one that worsens when you lie down. Lung cancer affects your airways and causes irritation long before it affects your breathing. The tumor doesn't need to be large. It just needs to touch the wrong nerve or airway. What makes this particularly dangerous is that people over 60 often have other respiratory issues: COPD, asthma, chronic bronchitis. So they dismiss a new cough as part of their existing condition. But even if you have lung problems, a new pattern of coughing deserves investigation. Your lungs aren't the only organs that send early warnings through unexpected symptoms. Sign number 6. Difficulty swallowing you're adapting to. Helen was 68, living in Michigan. Over several months, she noticed swallowing became slightly harder. Not painful, just effortful. She started cutting food into smaller pieces, chewing more thoroughly, avoiding certain textures. She thought it was normal aging, maybe dentures not fitting quite right. By the time she mentioned it to her doctor, esophageal cancer had been growing for nearly a year. Caught it before it spread, but only barely. Swallowing involves 50 different muscles and nerves working in perfect coordination. When something disrupts that coordination, when a tumor narrows your esophagus even slightly, your brain compensates. You unconsciously modify your eating habits. You don't even realize you're doing it until someone points it out. The medical term is dysphagia, and it's one of the earliest signs of esophageal and throat cancers. Watch for these specific changes. Taking longer to finish meals than you used to. Feeling like food gets stuck briefly. Needing extra liquid to wash food down. Avoiding certain foods without consciously deciding to. These adaptations happen so gradually that they feel normal. But they're not. Your swallowing mechanism shouldn't change just because you're older. And speaking of changes that sneak up slowly. Sign number 7. Night sweats that soak your sheets. Richard was 63, living in Phoenix. He started waking up drenched every night. Sheets soaked, pillow wet, pajamas clinging to his skin. He blamed Arizona heat, even though he'd lived there for 20 years without this problem. He bought a better air conditioner. Still happened. He tried lighter blankets. Still happened. Finally, his wife insisted he see a doctor. Lymphoma. The night sweats were his immune system responding to cancer cells, releasing chemicals into his bloodstream. Night sweats from cancer are different from normal sweating. They're drenching. You're not just warm or a bit damp. You wake up like you jumped in a pool. Your sheets need changing. Your pajamas are completely wet. And it happens repeatedly, not just once or twice. These sweats often come with unexplained fever that rises and falls without any infection. Your body temperature spikes at night, then normalizes by morning. You feel fine during the day, which makes you dismiss it. Lymphoma, leukemia, and several other cancers trigger this pattern because cancer cells release cytokines. These proteins tell your body to raise its temperature, attempting to fight what it perceives as an invader. Your hypothalamus cranks up your internal thermostat, then your body sweats excessively trying to cool back down. Margaret experienced this at 65. She thought it was late menopause, even though she'd finished menopause years earlier. Women especially dismiss night sweats because they associate them with hormonal changes. But if menopause ended years ago and suddenly night sweats return, that's not hormones. That's something else. Men have no hormonal excuse to lean on, yet they often blame stress or room temperature. Richard kept adjusting his thermostat lower and lower, got down to 62 degrees, still woke up soaked. If you're experiencing drenching night sweats more than twice a week for over a month, get checked, especially if combined with unexplained weight loss or persistent fatigue. Those three together form what doctors call B symptoms, classic warning signs of lymphatic cancers. But cancer doesn't always announce itself through dramatic symptoms. Sometimes the warning is quieter. Sign number 8. A sore that refuses to heal. Thomas was 67, loved gardening, lived in Florida. He noticed a small spot on his forearm. Looked like a scrape. He figured he scratched it on a rose bush. Weeks passed. It didn't heal. It didn't hurt. Didn't grow much. Just stayed there. Red, slightly raised, sometimes crusted over. He put antibiotic ointment on it. No change. After 4 months, his daughter noticed it and insisted he see a dermatologist. Basal cell carcinoma. Most common form of skin cancer. Highly treatable when caught early. Your skin is your body's largest organ and the most visible cancer warning system you have. A wound that doesn't heal within 3 weeks is abnormal. Your skin cells should regenerate and close any opening within that time frame. When they don't, something is interfering with normal healing. Skin cancers often disguise themselves as minor injuries. A small bump that bleeds when you scratch it, then doesn't fully heal. A patch that looks like eczema, but doesn't respond to typical treatments. A mole that starts changing shape or color. The 3 danger signs dermatologists emphasize: asymmetry, irregular borders, and color variation. If you draw an imaginary line through a mole and the 2 halves don't match, that's asymmetry. If the edges are ragged or notched rather than smooth, that's irregular borders. If you see multiple colors within one spot, black, brown, tan, red, white, or blue, that's variation. People over 60 often have accumulated sun damage from decades before sunscreen became routine. That damage can activate into cancer years or decades later. You might not have sunburned in 20 years, but the damage from your 30s is still there, waiting. Dorothy had a spot on her nose, thought it was a pimple. It would scab over, she'd pick the scab, it would scab again. This cycle continued for 5 months before she realized pimples don't last 5 months. Squamous cell carcinoma, the second most common skin cancer. Check your skin monthly. Use a mirror for your back. Ask someone to look at your scalp. Most skin cancers appear in sun-exposed areas, but not all. Melanoma can develop anywhere, including places that never see sunlight. And while we're discussing visible changes, there's one more that people consistently overlook. Sign number 9. Hoarseness lasting beyond 2 weeks. James was 69, retired teacher, lived in Seattle. His voice got raspy. He figured he'd strained it cheering at his grandson's baseball game. 2 weeks later, still raspy. He thought maybe he was getting sick. A month in, still raspy. Finally saw his doctor. Laryngeal cancer. Caught early enough for successful treatment, but he'd waited almost 6 weeks. Your vocal cords are delicate. When you get a cold or yell too much, they swell temporarily. That swelling should resolve within 2 weeks maximum. When it doesn't, something else is causing persistent inflammation or obstruction. Throat cancers, especially in the larynx, create lasting hoarseness because tumors physically interfere with vocal cord vibration. Your voice doesn't just sound tired or strained. It sounds fundamentally different, rougher, breathier, weaker. Pay attention to voice changes that persist. Not just hoarseness, but also changes in pitch, difficulty projecting, or a feeling that you need to clear your throat constantly. That last symptom, persistent throat clearing, often accompanies throat cancer because your body senses something shouldn't be there. Smokers and former smokers face higher risk, but non-smokers get throat cancer too. Alcohol consumption, HPV infection, and chronic acid reflux all contribute. If you're over 60 with any of these risk factors and your voice changes for more than 2 weeks, get scoped. An ENT can visualize your vocal cords directly and spot problems immediately. Sign number 10. Persistent bloating that's become your new normal. Catherine was 62, living in Boston. For months, she felt bloated. Not after big meals, just constantly. Her pants felt tight by afternoon every single day. She blamed menopause, age, maybe eating too much bread. She bought looser clothes, started wearing elastic waistbands, adapted completely to this new discomfort. 9 months later, during a routine exam, her doctor pressed on her abdomen and felt something. Ovarian cancer. Stage 3. Catherine's doctor explained that persistent bloating is one of the earliest and most ignored symptoms of ovarian cancer. Women dismiss it as digestive issues, weight gain, or normal aging. But your abdomen shouldn't feel swollen and tight every single day. Ovarian cancer is silent because the ovaries sit deep in your pelvis. Early tumors don't cause pain. They just take up space. As they grow, they press against your intestines, your bladder, your stomach. This creates a feeling of fullness and bloating that never quite goes away. The bloating from ovarian cancer has specific characteristics. It's persistent, meaning it happens most days. It's progressive, meaning it gradually worsens over weeks and months. And it's often accompanied by other subtle symptoms. Feeling full quickly when eating, pelvic discomfort, needing to urinate more frequently. Jennifer was 66. She noticed she couldn't finish meals anymore. Half a sandwich and she felt stuffed. She thought her stomach was shrinking with age. Actually, A growing tumor was taking up space in her abdomen, leaving less room for food. She also started urinating more often, thinking maybe it was just getting older. The tumor was pressing on her bladder. These symptoms are so common and so easily explained away that ovarian cancer often isn't caught until advanced stages. But here's what matters. If bloating persists for more than 2 weeks, especially with pelvic pain, difficulty eating, or urinary changes, demand an ultrasound. Not in 3 months. Now, doctors sometimes dismiss these complaints as irritable bowel syndrome or normal aging. If your doctor isn't taking you seriously, find another doctor. Ovarian cancer caught in stage 1 has a 90% 5-year survival rate. Caught in stage 3, that drops to 39%. The difference is being pushy about vague symptoms. Now you know all 10 signs. Let's be honest about something. You probably recognized yourself in at least one of these stories. Maybe you've got a cough that's lingered. Maybe you've been more tired than usual. Maybe your bathroom habits shifted months ago. Here's what you need to understand. Every single person in these stories thought they were fine. Susan almost ignored that white patch. Margaret celebrated her weight loss. Thomas blamed his bathroom issues on diet. They all had reasons to dismiss what their bodies were saying, but they didn't. And that's why they're alive. Cancer caught in stage 1 is often curable. Stage 2, highly treatable. Stage 3, much harder. Stage 4, you're managing it, not curing it. The difference between stage 1 and stage 4 is often just paying attention 6 months earlier. Your body is talking to you right now. It's showing you things, small changes, subtle shifts. Most people ignore these whispers until they become screams. Don't be most people. Check your mouth weekly. Track your weight monthly. Notice your energy levels. Pay attention to bathroom patterns. Listen when your body says something's different. And when something persists beyond 2 weeks, when it doesn't resolve on its own, when it gradually worsens instead of improving, see a doctor. Not eventually. Soon. You're not being paranoid. You're not overreacting. You're not wasting anyone's time. You're doing exactly what keeps people alive past 60, 70, 80, and beyond. The people who make it to 90 aren't lucky. They're attentive. Every sign on this list can be caught early. Every single one. That's not luck. That's you deciding your body's whispers matter enough to investigate. Because they do.